There is a common drug that we are all familiar with that continues to reveal more and more health benefits. We're talking about something that might be in your cabinet as we speak, aspirin. And a new study has come out, and the doctor is in to tell us the very latest findings. Dr. Scott Ackerman, one of the First Coast's leading oncologists, he joins us every Friday to talk about important issues. And you have talked about the importance, being an oncologist, of aspirin before, but now there's a recent study that just came out talking about aspirin and ovarian cancer.
Correct. So I've talked about aspirin before, and we do know about the health benefits of aspirin, not just for coronary artery disease, but I've also shared with you before that we know that aspirin helps reduce certain incidence of certain cancers, colon cancer, breast cancer. But there's a new study that came out last week. The National Institutes of Health analyzed 12 different studies, so it was an amalgamation of a number of studies, and in all these studies were about 20,000 women, and about half the women had ovarian cancer and half the women didn't have ovarian cancer. And women in these studies took aspirin on a regular basis, primarily because they were trying to prevent a second cardiac incident. They had a heart attack or something. Some of them took a Motrin or Aleve, what we call non-steroidal anti-inflammatory agents, on a fairly regular basis. Some took Tylenol on a regular basis, and some women took nothing at all. And as it turned out, those women that took acetaminophen, Tylenol, had the same incidence of ovarian cancer than those women who didn't take anything at all. Those women who took the non-steroidal anti-inflammatories like Motrin or Aleve or Advil had a small benefit. There was a 10% lower risk of those women developing ovarian cancer. But that 10% was pretty small, and it wasn't really statistically significant because it was such a small amount. But those women that took aspirin, and these are small baby aspirin, they took less than 100 milligrams. Usually it's an 81 milligram baby aspirin. The women that took that on a daily basis had a 20% lower incidence of ovarian cancer than women that didn't take anything at all.
Yeah.
Right, and it just happened, you know, they weren't taking it for that reason, they were taking it for other reasons, but that's a significant decrease in the risk of ovarian cancer.
Well, and so we're talking about ovarian cancer, but by taking an aspirin, it can also help reduce the risk of getting other diseases as well.
We're finding all the time new health benefits for aspirin. It really is a wonder drug. It's been around for a long time, it's cheap, it costs about 1 cent a pill. There's been long-standing evidence that aspirin helps with heart attacks and stroke prevention. So people that are at high risk for coronary artery disease, they're usually put on the aspirin by their cardiologist. It helps prevent strokes. And also we do know that it helps prevent breast cancer, melanoma, colorectal cancer. We see some benefits in that. And also another recent studies have also shown, and multiple studies have shown, that it reduces the risk of Alzheimer's disease by over 50%. So there's lots of benefits to aspirin.
So that old saying, an aspirin a day keeps the doctor away.
It's apple.
Whatever, we're changing it to aspirin. It's going to be an aspirin now, keeps the doctor away. Right. But when, okay, so when do we take it? How do we take it? Take it with food, take it in the morning, night, what do we do?
Well, people have looked at what time of day is best to take aspirin. And if you're taking it to minimize the chance of coronary artery disease, it's best taken before bed. Because most people have, if they have a heart attack, it happens in the middle of the night. So the benefit best for heart attack or for cardiac episodes is at night. But I think that for general purposes, if you're taking it for cancer prevention or cancer minimization, any time of day, it doesn't matter, because you're taking it every day. You just want those levels in your body.
All right.
It's probably best to take it with food, because it'll help minimize any gastric issues. Some people have sensitivity to aspirin, could cause stomach bleeding, those sort of things. And so it's best to take it with food. And it really doesn't matter what time of day if you're taking it to diminish your risk of cancer.
Okay, well, and I'm sure a lot of people might be thinking to themselves, if I'm taking this aspirin every day, are there any risks associated with that? Are there any dangers of taking an aspirin a day when I don't have a headache, or, you know, I'm just taking it for preventative measures?
Right. So aspirin, some people do have aspirin sensitivity. There's some people that have allergies to aspirin. Some people, it thins your blood, so you bleed more easily. I take aspirin every day, and sometimes if I cut myself shaving, it'll bleed a little bit more than it used to, but it stops.
Okay.
But so you need to be aware of that. Some people have a stomach sensitivity to aspirin, and it could cause bleeding or gastric ulcers. Some people have a sensitivity where it causes ringing in their ears. As always, I recommend talking to your physician about it before before you take an aspirin to make sure that it's safe for you to take aspirin.
And last
regularly.
and not least, for people who might be watching, is this something for everyone to be doing? I mean, is there a certain demographic, certain ages, an age that you should start taking an aspirin a day?
Well, there's really compelling evidence to support the use of aspirin for cancer prevention. I think in general it's beneficial for most people. It's important to talk to your physician before starting an aspirin regime, but how early is too early to start? I think that once you're an adult in your 20s, it's certainly safe.
Okay.
Yeah. If you want to minimize your risk of developing cancer, breast cancer, ovarian cancer, that's the time to start. You know, ovarian cancer, the problem with ovarian cancer is that we have no good screening test for it. We can't diagnose it early. About 24,000 women in America are diagnosed every year, and half of them, about over half, 14,000, die every year. We have no screening tool for that. So maybe if you could reduce your risk of getting it by taking aspirin on a daily basis, we could really save lives.
Okay. No, I'm not shaking your hand. I want the aspirin.
There you go. There's a baby. Every day, take that one.
Every day.
That's yours. That's my gift to you.
And remember, an aspirin a day keeps the doctor away. Now I shake your hand. As always, Dr. Ackerman, we appreciate you coming on here and your expertise, and thanks so much for sponsoring this segment. And if you have any questions regarding today's topic or any other health questions that you may have, you can always connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology. Just get your questions answered if you have them by going there.